Hello, parents. Let's talk about something many of you worry about, your baby's poop. You know, it can be surprising how much time we spend thinking about it. Is it the right color? The right texture? Is it happening often enough? Seeing your little one struggle to have a bowel movement is tough. It can make you feel worried and helpless. You might wonder if you are doing something wrong or if your baby is in pain. These feelings are completely normal for any loving parent to have. Rest assured, you are not alone in this experience. The good news is that infant constipation is very common. It is a normal part of a baby's development. Their tiny digestive systems are still learning how to work properly. Think of it like a new machine that has a few kinks to work out. As your baby grows and their diet changes from breast milk or formula to solid foods, their bowel habits will also change. These transitions are often when you might notice some difficulties. It's a temporary bump in the road for most babies, and there are many gentle ways you can help them through it. It's important to know that a baby's pooping schedule can vary a lot. Some babies poop several times a day. Others might go a few days without a bowel movement. This is especially true for breastfed babies, who can sometimes go up to a week without a dirty diaper and still be perfectly fine. This wide range of what is normal can be confusing for new parents. The key is not just how often they go, but how comfortable they are when they do go. Understanding this can save you a lot of unnecessary worry. So let's take a deep breath together. Managing your baby's constipation is usually something you can do right at home with some simple and gentle techniques. It's about helping their little bodies get back into a comfortable rhythm. This journey of parenthood is filled with learning curves, and figuring out your baby's digestive needs is just one of them. We will walk through what to look for, what you can do to help, and when it might be time to chat with your trusted pediatrician for a little extra support. First, let's figure out what constipation really means for a baby. It is not just about how many days have passed since the last poop. True constipation is more about the difficulty and discomfort your baby experiences. You are looking for specific signs that show your baby is struggling. A baby who is constipated will often seem very uncomfortable or even be in pain when they are trying to have a bowel movement. They might strain, cry, and get red in the face for more than a few minutes without being able to pass any stool. One of the clearest signs of constipation is the poop itself. When your baby finally does have a bowel movement, take a look at the diaper. The stool of a constipated baby is often hard, dry, and looks like small, firm pellets or little balls. It might be dark in color. This is very different from the typical soft, pasty, or seedy stools of a healthy baby. If you see these little hard poops, it's a strong clue that their system is having a tough time. Sometimes you might even see a little bit of blood from a small tear caused by the hard stool. Another thing to watch for is your baby's behavior. A constipated baby is often a fussy and irritable baby. They may have a poor appetite and refuse to feed because their tummy feels full and uncomfortable. You might also notice that their belly seems a bit swollen, firm, or bloated to the touch. They might pull their legs up towards their chest, which is a common way for babies to show that they have tummy pain. These are all signals from your little one that something just doesn't feel right inside. Remember, grunting and straining can sometimes be normal for a baby. Their abdominal muscles are still developing, and they are learning how to coordinate everything to push poop out. This is often called infant dyschezia. The difference is that with dyschezia, when the poop finally comes out, it is soft and normal. With constipation, the straining is followed by hard, dry stools or no stool at all. Paying close attention to these details will help you know if it's true constipation or just your baby learning how to use their body. When you know your baby is constipated, your first instinct is to help them feel better. Luckily, there are many safe and gentle things you can do at home. One of the best techniques is a warm, soothing bath. The warm water can help your baby's muscles relax, including the ones they use for pooping. This can ease their discomfort and sometimes encourage a bowel movement right away. After the bath, you can follow up with a gentle tummy massage to provide even more relief for your little one. A tummy massage is a wonderful way to help get things moving. Lay your baby on their back in a comfortable spot. Using a little baby-safe oil or lotion on your hands, gently massage their belly in a clockwise direction. This follows the natural path of their intestines. Use your fingertips to make slow, circular motions around their navel. You can also try gently pressing their knees towards their tummy and holding for a few seconds. This can help apply a little pressure to the colon and relieve gas, making it easier for them to poop. Another simple and effective trick is to move your baby's legs. With your baby lying on their back, hold their little legs and gently move them in a bicycling motion. This movement helps stimulate the bowels and can be very effective in getting things going. It also helps release any trapped gas that might be adding to their discomfort. You can make it a fun game, smiling and cooing at your baby while you do it. Think of it as a little workout session that has a very important purpose for their digestive comfort. For babies who are formula-fed, sometimes a change is needed. Talk to your pediatrician before making any changes to your baby's diet. Occasionally, a specific type of formula might be contributing to the constipation. Your doctor might suggest trying a different brand or a special formula designed to be easier on a baby's tummy. Never give your baby laxatives, suppositories, or enemas unless your doctor specifically tells you to. These gentle, non-invasive home remedies are always the best and safest place to start. While home remedies are often very effective, there are times when it is important to call your pediatrician. You should always trust your parental instincts. If you are worried or feel that something is seriously wrong, making that call is the right thing to do. If your baby is younger than 4 months old and you suspect they are constipated, it's always a good idea to check in with your doctor. Their systems are very delicate, and it's best to get professional guidance before trying too many things on your own. There are also some specific warning signs that mean you should seek medical advice right away. If your baby is not only constipated but also has a fever, is vomiting, or refuses to eat at all, you should contact your doctor. Another red flag is if you see a significant amount of blood in their stool, more than just a tiny streak. If your baby's abdomen is very swollen and hard, or if they seem to be in severe, constant pain, it's time for a professional evaluation to rule out anything more serious. If you have an older baby who has started solids, you can sometimes introduce certain foods to help. For babies over 6 months, a small amount of water or 100% fruit juice, like prune, pear, or apple juice, can help soften their stool. You can also offer pureed foods that are high in fiber, such as prunes, pears, peaches, or peas. However, if you have tried these gentle dietary changes for a few days, and the constipation is not getting any better or is getting worse, it's a good time to consult your doctor. In the end, please remember that constipation is almost always a temporary issue that can be managed. You are doing a great job. By being attentive and trying these gentle solutions, you are providing wonderful care for your baby. Your doctor is your partner in your child's health and is there to support you. Don't hesitate to reach out to them for help. Together, you can get your baby's system back on track and see them happy, comfortable, and full of smiles once again.